Everybody smile.
You can release your video order here. What?
Delete a slide out of my PowerPoint.
Okay, so you know what we'll do? It's not a problem after. Yeah, because we're live.
Yeah.
All right. Good evening, everyone, and welcome. Tonight, as you know, is an all church Bible study as opposed to an all church meeting. We have taken all of our courses and brought all of you together tonight because we want to make sure that you are well informed about the most recent updates concerning the COVID-19 as well as the vaccines. There are a lot of questions floating out there. We thought it would be a wonderful thing tonight to bring in professionals to answer your questions. So the first thing we're going to do, you all know we reopened last Sunday. It was amazing. Preaching to empty chairs for a year was a real challenge. And it was so nice to have 25% of you back home last week. So Elder Dwight's going to update you with regard to the procedures for coming back to in-person worship. And then our own Minister Gia is going to take it away with her amazing guest tonight. Elder D, to you.
Thank you, Pastor. Welcome, STCF family. Just have a couple of items just to cover, just to make sure you have all the information that you need and regarding you coming back to service. Number one is registration. To reserve your seats for service on Eventbrite, you will need to register your entire family that is attending. You will be seated with those with you register with. Registration for STCF members opens on Thursday at 9:00 a.m. Registration for non-members opens up at Saturday or on Saturday at 9 a.m. If you are serving in a department on Sunday, do not register with the general public on Eventbrite. Please check with your department director to register. Now, the way registration would take place is it's based upon two groups. Group number one, which will be on the first and third Sunday of the month, last name beginning with A and ending in K. Group number two will be the second and fourth Sunday of the month, last name beginning with L and ending in Z. Note, fifth Sundays as well as holidays will be open for registration for the entire membership. So try to get on there as soon as possible. The church will also alternate its Sundays for communion service. So those Sundays that you miss, we will alternate so that way you can participate with communion as well. On Sunday morning, it's very important when you come to Sunday morning service, please complete the COVID screening questionnaire. It's at stcfoc.screen.healthcare. Also, you'll receive an email blast as well as a text. Make sure that is completed before you come to Sunday morning service. That is very important. Upon arrival, please be prepared to show your completed pass for your COVID screening. That way we can get you in through the process and get you right into the service as quickly and promptly as possible. A couple of notes and then we'll come to a conclusion. As Pastor has shown that, you will be required to wear a mask from the arrival time to the exit time as well. Please go to the church website. It'll give you all the information regarding the guidelines that you would need to make sure you are safe and that we are all safe in the house of God. Doors for volunteers will open up at 8:30 a.m. Doors for attendees will open up at 9:30 a.m. and we will close promptly at 10:15. So make sure you're there on time. Once registration is closed for the day, no one will be permitted into the house of the Lord at that time. So hopefully if you have any questions or any concerns, please go back to the church website as well. That will conclude my portion of the registration process. I will now hand it over to Minister Gia at this time.
Okay. Hi, Elder D. Can you do me a favor? Can you guys enable screen sharing? I need to share the PowerPoint.
Yep, sending it right to you. You are now the host.
Right.
If I came over there to different standards, I brought a chair with your standards.
Not at all. You know what? What about the folding?
Yeah.
Okay.
Okay. Can you all see my screen?
Mhm.
Right.
Yes.
Wonderful.
If you hit this little, see this little thing here? If you click that, it'll go full for you. I'm right underneath it. Yeah.
There we go.
There
Okay.
you go.
All right, welcome everyone. Thank you all for attending and joining us tonight for our COVID-19 Town Hall meeting for Set the Captives Free Outreach Center. I want to definitely acknowledge my pastors, Pastors Karen and Pastors Linwood and Elder D. Thank you so much for hosting this platform tonight. I welcome my colleagues for joining and thank you all for your heart to serve and for serving our church community and the Woodlawn community tonight. So getting started, I am going to introduce my guest that I have with me tonight. I have with me Miss Michelle Beador Turner, who is a nurse practitioner and has been for over 18 years in the field of oncology, where she has served in GI, melanoma, and lung cancer. She is currently the solid tumor nurse practitioner manager at Johns Hopkins University, and Bayview, excuse me. And she has also been a frontline worker since COVID showed its face before all of us, as well as a task force coordinator in policy and procedures for COVID procedures in clinical practice. I have with me tonight Tanoa Hampton. Thank you for joining us tonight, Tanoa. Tanoa is the founder and executive director for Balm Inc. 501c3 organization, where her mission is to empower women to achieve optimal health and well-being throughout health education and literacy programs. She is a master's prepared registered nurse, a doctor of public policy and administration candidate, and she is a certified health minister and health coach with 25 years of experience and a frontline worker. Welcome to Noah. Thank you for joining us tonight. And our third panelist tonight is Marsha Carter Hall. She is a double board certified nurse practitioner specializing in family medicine and is passionate about holistic care and preventive health. She is the CEO and founder of Quench Infusions and Wellness. She is dedicated to clinical practice and assisting in bridging the vaccination equity gap amongst African Americans and a frontline worker as well. So we welcome our guests tonight for the panel discussion and town hall meeting for Set the Captives Free Outreach Center. So welcome you all and thank you. I did not introduce myself. I didn't want to take for granted that everybody knows who I am, but I am Minister Gia. I am a doctor of clinical nursing practice and practice over 25 years. I am currently working in private practice in Pennsylvania. I have been quite active in the COVID scene since the onset of COVID as a frontline worker, clinical coordinator for COVID policy and procedures. And I am glad to be your host tonight for our town hall meeting. So moving forward, let's get started with some statistics. Where are we right now after a year of looking into COVID? So tonight we plan to address with you some worldwide statistics and our local community statistics as to where the surrounding counties are for our church and other catchment areas. We are also going to address the vaccination. That is the hot topic amongst many platforms and where we currently stand and why we all need to be informed about how this vaccination works, address some truths and some myths about the vaccination, and where are we now? Where do we go from here a year later into into COVID pandemic that we thought was just going to be here for 3 months, but it has been here for a little over a year now. And so where do we go now that we have some answers that we didn't have before? We have some questions that we didn't have last year, and we have a vaccination that we are all facing. So we're going to talk about those topics, hear your heart, answer your questions, and hope that you leave empowered, informed, and know that we all have a part to play in managing this pandemic. And so where we are currently there are a little over 30 million cases in the United States at large of active COVID. And what that means is these are confirmed cases. These individuals have been diagnosed or are currently diagnosed and either have survived COVID or currently are hospitalized with COVID. The current confirmed deaths are over 550,000 in the United States alone. The cases of COVID worldwide are over 128 million cases. And that includes all islands, including those that are not directly linked to being in the United States. There are 72.6 million recovered cases, 2 million global deaths, actually a little over 2 million global deaths, almost 3 million. And these statistics are active as current as of midnight last night. So it does not take into account any statistics that have come in today or overnight. And so looking at our direct area of influence, confirmed cases in Maryland, or for over 400,000 confirmed cases and a little over 8,000 deaths confirmed in Maryland as of to date. Our direct encatchment area, meaning where the O Center is and the surrounding counties and the surrounding cities, the zip codes have been listed. So the 21244 zip code, there are almost 3,000 active cases of COVID confirmed. In the 21207 zip code, there are over 3,600 confirmed cases of COVID. In the 21228 zip code, 3,600 confirmed cases. In the 21133 zip code, 2,400 confirmed cases. And in the 21229 zip code, there are 3,400, a little over 3,400 confirmed cases, totaling the encatchment area cases to over 16,000 cases as of to date in our encatchment area. So that means we still have some work to do in our community. We still have some things that we have to do better to get these numbers down. And we're going to talk about how we do that tonight. What is our role and what is our responsibility in bringing these numbers down, or hopefully sustaining these numbers where we don't continue to see the 10% rise that is anticipated if we don't get some control over the pandemic as it is right now. So we're going to bring to the forefront Ms. Tanoa Hampton, where she's going to talk to us tonight about the current statistics of the vaccinated community and access to vaccinations as it stands to date. Tanoa, you have the floor.
She has to unmute. There we go.
So good evening, everyone. My name is Tanoa Hampton. I'm a registered nurse, and I actually serve as, in my daytime job, as the executive director for the Board of Nursing. So I'm looking at the nursing workforce in the District of Columbia. Thank you for this opportunity to share with you tonight in regards to the COVID vaccination numbers in our community and the access. Dr. Gia has so eloquently discussed the impact of the coronavirus on our community globally, but as well as locally. And so we are now in a posture where we must begin to educate the community. And I thank you, Apostle Bethia, for taking this opportunity to educate your church and those that would log in tonight to view this information. It's very important to have these conversations where we bridge our faith with our health, because we know that they're both interconnected, and we must do our best to educate ourselves. So how we do one thing is how we do something else. So as we take care of our spirits, we will take care of our bodies as our temples. So with that said, I want to give you some numbers with regards to our vaccination. We know that the CDC recommended a phased-in approach where frontline workers receive some of the first COVID-19 vaccination. And we're so grateful for those that are serving on the panel that have taken the charge and have continued to serve our communities throughout this pandemic, tirelessly fighting compassion fatigue. We appreciate you. And so we have been seeing many of our fellow states rapidly opening because we understand we want to get people back to work, to worship, and to play. It's good not only for our physical health, but our spiritual health. We're currently in the state of Maryland in what's called vaccinations phase B, which has been very helpful. And those that have been fully vaccinated, which means they've either received the two-step vaccination and or the Johnson & Johnson one-step vaccination, those numbers are 969,451, of which we know that those individuals are fully vaccinated, but those who have just received the first dose of one of the vaccines is 1,720,473. And those that have had the second dose of those 1 million plus is 897,129, and 72,322 have received that single dose vaccination. And again, that's phenomenal, but we still have a lot of work to do. Despite the controversy and the things that people have heard about the various vaccines, we ask that you truly take the opportunity to become one of those who are vaccinated. And with that said, Governor Hogan announced at the beginning that he would be opening mass vaccination sites, and it should be 12 total. He just opened one most recently in Montgomery County, and where I reside, there's one right here at Six Flags that they're having appointments online that you can get into. So if you fall in any of the categories now up to 2B that are a priority area, we ask that you and are encouraged to join and have those vaccinations. So currently in the state of Maryland, we have delivered 2,705,455 vaccines. Again, a lot of work to do to meet the needs of our population. So here in the state of Maryland, so that we can get back to work, worship, and play for our mental, physical, and emotional health. So those are our numbers. But again, Maryland, the state of Maryland actually has a vaccine website that provides you links to the various vaccination clinics. Right now, there are about 2,500 points of distribution points and sites and centers, and they're looking to extend further into our physician offices as well as your local pharmacy. So I can say that I know that Walgreens and CVS have online portals for you to go in and receive, schedule appointments and receive them at your local pharmacies as well. So it's very important, but those are our totals and data as of 10 a.m. this morning. Those are the totals of vaccinations. They're being updated daily, but again, please get out there, get one of the vaccines, whether it be the two-step or the one-step. It's vitally important to you and your community as well as the world as a whole, so we can get back to normal. Thank you, Dr. Gia.
Thank you, Tanoa, for sharing that. Thank you so much. Such important information. And to put that in perspective of just how far 2 million is great. But when you look at the global impact of 30 million, we still have so much more to do. And so again, we're hoping that after you leave tonight, you will consider the information prepared before you and again, make a wise decision. The Bible says my people perish for a lack of knowledge. And so we're giving you the knowledge, we're giving you the facts. It's not our personal opinion. Many of us have had to take this L on the chin and do what we have to do because it's really beyond us, and it's a greater at risk than just you or I. So we are praying that this will bless you to make an informed decision after tonight. So thank you again, Tanoa, for those statistics. Thank you so much. And so we're going to talk about the vaccination. We're going to talk about some myths and some truths to bring you to an understanding. Hear me clearly. We're not here to sell you on Pfizer, Johnson & Johnson, Moderna. We just want to inform you so that you can make the best decision for yourself from a health perspective, from a community responsibility, and for your family. And so let's hear tonight from Miss Marsha Carter Hall as she talks to us tonight about the vaccination, some myths and some truths.
Thank you, Dr. Gia, for having me. Can you hear me okay?
Yes, we can.
Okay, great. Hello, everyone. Hello, congregation. I just want to go ahead and get into some of the truths and myths. The COVID-19 vaccine, you will hear a lot of things, but I encourage you to do your own research and talk to trusted professionals, talk to medical professionals, and not Dr. Google. I like to make sure that I put that out there because a lot of people will Google things, but we have to go with what is proven. So we want to just start there. But the first question that came up was through my research was, will a COVID-19 vaccine protect me from getting sick with COVID-19? And the answer to that is yes. The vaccination actually teaches your immune system how to fight the virus that causes COVID-19 and protects you from getting sick. So in the event of you contracting COVID, you hopefully will only have a mild illness versus a severe illness or long-term effects or even death. So having the vaccine on board actually helps you. Another one was vaccines were developed too fast to be safe. That's a myth. The technology that was used to develop the vaccines is decades old and has been utilized in cancer research and a lot of other medications being made and a lot of other pharmaceutical things that they do in the background. So the way that the medication and the vaccine was put together is not new. Clinical trials were done for the COVID-19 vaccines and they were applied, the same rigor was applied to those. They weren't like pushed through or anything like that. The reason why we were able to get the vaccine so fast is because there's newer technology and more funding available at the federal level for us to bring some resolve to the pandemic, get the vaccines out there so we can decrease the amount of people that are being affected with COVID. Another one was, after vaccination, I won't have to continue to wear my mask. No, absolute myth. You have to continue to wear your mask. You have to continue to social distance, because everyone is not going to be vaccinated at the same time you're going to be vaccinated. It's going to take some time for the population to be vaccinated, and the mask and the social distancing keeps you from passing the virus to someone else. Oh, my apologies. And it also keeps someone from potentially giving you anything outside of COVID-19, because there's other things that we can catch as well. So you just want to make sure that you know that you have to wear your mask even after your vaccine. COVID-19 vaccines will deliver a microchip in the vaccines. No, that is a myth. I don't know where that started, but it is a false rumor. And apparently it started after there was comments about digital vaccine records and how you're going to have things scanned on your phone to go into certain places and so forth and so on. Absolute rumors. The state has to have the immunization record documented, and that's nothing new. All of your MMRs and your Hep Bs and your flu shot and everything has a digital trail. Those things are in your medical record and so forth and so on, but there's no electronic components being put into your body from the vaccine. The vaccine itself is made with mRNA technology. There's lipids inside of it, salts and other agents that stabilize the vaccine, and that goes inside of you, but it is strictly pharmaceutical products, nothing technical about it. I already had COVID-19, so I don't need the vaccine. No, You still need the vaccine. That is a myth. The natural infection immunity is what happens after you've had COVID-19, but the science isn't sure how long your body is going to hold on to that immunity. So we still would like you to, the CDC is recommending that even if you had COVID-19, that you still opt to get your vaccine. If you have an active COVID-19 infection at this time, you have to wait at least 90 days before you're able to get a vaccination. But you definitely still need to get it regardless if you had COVID or not. And if I can still contract COVID-19, then receiving a vaccine is pointless. No, that is a myth. Getting the vaccine is absolutely not just for you. It is for the community, it is for your family and loved ones, and it's for all those that have already lost their life to COVID-19. 2 weeks after receiving the vaccination, you have some built immunity. You should have some built immunity to the COVID-19 virus. Your body has that built-in protection that I was just talking about. With Pfizer and Moderna, those vaccines have 2 doses. So it is important for you to go back for that second dose. You have to go back for the second dose. At 2 weeks after that, your body should have the immunity that you need. The Johnson & Johnson, that is the 1 dose. 2 weeks after that, same thing. The benefits of receiving the COVID vaccine, and also, staying on target with receiving your vaccines on, when you're due for it. You want to make sure that you're not late or anything like that, that you actually come to that appointment, because I do know that science is showing that people are having a hard time getting back to that second dose. And you can't just think, oh, if I got 1, that's it. No, you need to still get it. Population immunity is another reason that you're getting the vaccine, because your neighbors, the children and everyone else, the more people that are vaccinated, the bigger benefit we'll have for our communities. And then also, we still have new variants. We see that often on the news. We see it in the newspapers, new variants, the virus are changing and so forth and so on. And the science does show that the vaccine is helping protect us also from some of those variants. So you're just doing a public service for yourself and for your community. This is a little slide that I asked Dr. Gia to put in there, because a lot of us, don't really know that the vaccine itself, how it works. I won't get into the whole science behind it, but how it works is the vaccine is introduced into our body. And the first vaccine we get, our body is like, oh, okay, I haven't seen you before. What's going on? Let me remember you. The second vaccine that you get, your body's like, oh, I've seen you before. What are you doing back so soon? And you have these memory T cells that recognize the virus when it visits again. And the B cells that remembers how to fight the virus. So if you were to be infected with COVID-19, the vaccine has those memory cells inside of your body that have been turned on, and they can recognize what to do and act accordingly. So hopefully not to have, damaging effects from COVID-19. My friend was sick right after receiving the vaccine. You hear this a lot. Now, I didn't put whether this was fact or a truth or a myth, because your friend may have been sick after the vaccine, but they weren't given COVID-19. It is the body's natural response to any type of foreign anything that is put into the body. After a vaccine, even as children, we have headaches, chills, fatigue, muscle pain, a fever. This is what you want your body to do. So I tell all my patients, and I tell those in the community, when you get your vaccine, just be prepared and expect a response. That tells you that your body is doing what it's supposed to do. So if you feel any of these things, it's not that you have COVID, or it's not that they gave you COVID in the vaccine. It's just that your body is working, and we have to thank it because we want to make sure that's what it's doing. I will say that the statistics, 15% of the people that received the vaccine had short-lived symptoms at the site of injection, just some soreness. They're calling it COVID arm, some tenderness at the site of injection. 50% developed a systemic reaction, which are the symptoms or the complaints that are listed above: the headache, the chills, the fatigue, and muscle pain and fever. So just be prepared and expect a response from your body, but just know that it's doing what it's supposed to do. And last is, we want to do it for our loved ones. We want to do it for our community, do it for yourself, and do it for our future. This is the absolute truth. We all want to get back to, just like Nurse Tanoa was saying, get back to play and ministry and work and just things that are normal for us. We want to get back to that. And so just consider the science and consider reaching out to, I'm open to for any questions or anything like that. And so I'm available for that, but just do it for the community. Thank you.
Thank you so much, Marsha, for sharing with us the information about the vaccination. So important. And definitely key things are understanding how the vaccination works in our body, because partly many of the myths and untruths that are going around is that they're giving us COVID, and that's not the truth. All vaccinations work differently. And what's really particularly for us to understand is that this is not like your flu vaccination. This is not like the immunizations that you got when you were a child, or if you've been through any type of transplant where you are being revaccinated or re-immunized. It is a little different behavior because COVID behaves a little bit differently. And with us trying not to be as technical as possible, but one thing to understand is that COVID vaccination is a RNA-driven vaccination. It is not a virus. It is not a DNA-driven virus. And because it is not, it behaves a lot different. It's a lot more aggressive than some of our DNA-driven viruses. So what those wonderful scientists that have been working on this vaccination worked to do was to isolate the most aggressive portion of this vaccination and the most common strain of this vaccination to develop the vaccinations that have been disseminated at this point. And as Marsha spoke about, yes, we know that there are different strains occurring. And that happens when we start developing resistance to the current one, or we stop exhibiting those behaviors to get control of what we currently have. So the virus gets comfortable. It gets comfortable and it starts developing different strains and different behaviors outside of what the norm is. And that's what keeps us on our game and keeps us on our point to keep developing preventive measures and preventive vaccinations, because cells get smart. Viruses get smart, and our job as clinicians, as scientists, as pharmacists, as those working in the field and those working behind the scenes, I absolutely give homage and salute to those scientists. Many of you may not know, but it was a young African-American woman, 30 years of age at the University of Maryland, that played on the front line of developing this vaccination. So please know that they are working and studying these, and you are going to hear talks about the new strains. And actually, I think someone gave us a question about will the COVID vaccination be like the flu vaccination? And we honestly don't know yet. We don't know if we will have to be revaccinated next year. We don't know if we will have to continue to get this year after year or get it again. No one has that definitive answer. What we do know is that we have to build up some degree of immunity and antibody protection to really know. And with the different strains out and the behavior different, it is not behaving like the flu. This is not behaving like the most common strain of the flu that is studied every year. And so you get that vaccination and you're one and done. So we don't know. So that's why we are encouraging you to get educated about the vaccination and make a decision to cover yourself in this point in time for what we do know is going to help us move forward in the seasons to come in the next several months. So that leads us to our discussion with Ms. Michelle Beador Turner, here who's going to give us some information and talk to the topic of where we are right now, what we're currently facing and the pandemic, and where do we go from here. And then we will definitely entertain some more questions for our panel.
Thank you, Gia. And I'm honored and humbled to be part of this panel of medical experts as well as ministry experts, because it really takes a village to make all of this work. And this is a picture of the cancer center that I work at Johns Hopkins. And as of March 13th of 2020, life had changed the minute we walked through the doors. It's a very different picture now than it was then. And so I think what's important to remember for us, that are in medicine at many different levels is that, although COVID has kind of changed the world itself, it's also changed the world of medicine and how we interact and respond to our patients. And especially when we're in fields where visual cues, emotions are really important, what we have to do on a daily basis is now masked, so to speak, and how to make those connections can become very challenging. So again, everything changed around the world. And so what has changed because of COVID-19? Well, as of that date, we all were mandated to, start to wear personal protective equipment. And back, at the time of the AIDS epidemic, the biggest change was donning or putting on gloves to see patients. Now, not only do we have to do that, but we have to wear face masks. And that changes, again, our personalities. We can't see patients' faces, their emotions, etc. All we see is the eyes. Same thing with providers. We have to wear face shields. So people that have hearing difficulties, again, those are multiple levels of equipment that make it difficult to care for patients. Very protective, but also very challenging. The family and the relationships change. Again, connecting with those individuals. We've also, because of the risk to our cancer patients, and patients with other kind of comorbid conditions, we limit visitations and kind of family support during their visits, because there wasn't a risk of the contraction of COVID in the hospital, but actually from outsiders and support individuals for patients coming in that actually increased the numbers. And so having that support at their visits, hearing news of scans or changes in blood work or changes in their diagnosis has become very challenging, and it's very emotionally difficult for patients. So it's a whole another level of the psychology behind not only just being sick potentially with another illness, but on top of it, kind of taking away the support systems that patients typically had. Personal distancing at home and in the community. Again, the sense of touch, hugging, giving a kiss, comforting people has been very challenging emotionally and physically. People's attitudes, behaviors, we see it, frustrations have certainly kind of heightened during this time. Staff distancing in the workplace, that was our support. We, Dr. Gia and myself worked together for many years at the University of Maryland. You supported your colleagues next to each other. That's how you got through the day. You asked questions, you talked about patient cases. Now they're more than 6 feet away or in a different office. And so again, the ease of communication and problem solving changed during this pandemic. Visitor policies, like I had mentioned before, even not only in outpatient visits, but in patients in hospitals. The nurses, the physicians, the advanced practice providers, the support staff within the hospital were patients' primary points of contact because their loved ones couldn't come through the door. FaceTime, again, with every blessing, with every curse does come a blessing. And, I'm thankful that we're in the age of technology where we could at least show patients their loved ones through a phone or a computer, just to actually increase morale and just emotional support. Limiting community and social gatherings. We're a social race, not being able to attend services on Sundays, not being able to attend parties, seeing family members. what that's done to the human spirit, again, not only physically what COVID has done, but really emotionally, even to our children who couldn't go back to school. All of these things are done and these restrictions are put into place for safety, and that's important. But again, the repercussions from that, and then how do we as a community kind of work around those restrictions or support people through those restrictions in order to maintain not only physical health, but mental health as well. And then travel restrictions, I think, which has been the hardest for a lot of people, because again, in the field of medicine and many other professions, burnout is there. And to go away, to step away, whether it's traveling to the nearby state or getting on a plane to visit family, was really hard. It's easy to say you don't want to do something, but when somebody tells you you can't do something, it's a very different picture. Next slide. So what are we doing now in terms of limiting and modifications? Again, the clinical operations, how we have patients flow through our clinic. The camaraderie of a waiting room is no longer there. There are less chairs for people to sit in, they're distanced. We know that we can't see the volume of patients that we used to, because every clinical room that we put a patient in has to be cleaned, decontaminated, weighted prior to the next patient, because these safety precautions are put into place to keep the community around us appropriately safe. But it again changes the dynamics of our clinic. So visits do take longer. We ask always for the actual patients as well. Enhanced cleaning, like we talked about, personal distancing, our staff distancing, in the workplace. All of these factors have changed, whether we're at work, whether at home. I have had some friends and colleagues and neighbors that said, oh, well, you're lucky you get to go to work every day. And yes, I am absolutely blessed and fortunate to be able to go to work and do the job that I love to do. But it also has been quite a challenge for individuals and in the medical profession to do the job we love to do without having the tools that we need to do it as well. Because it's actually, in the beginning, we didn't have all the resources that, again, we have now. And so we were limited with our protective equipment, and being on the front lines, that invokes a level of fear of what does that do to our own families as well. Again, limiting community and social gatherings, which has started to change because of vaccinations. But as our two colleagues said previously, the vaccine, although is there for a layer of protection, doesn't mean we're 100% safe. And so we still have to do our part to protect the rest of our community, the rest of our partners, professionals, et cetera, that haven't gotten the vaccine yet. That's really our duty. So it's a new way of norm. It's a new way of life. It's a way of life I, particularly being a hugger and a kisser, miss terribly. Personal contact, intimate contact is very challenging when you're dealing with patients, again, that have terminal illness. But we can't, again, I can't stress this enough, and it was noted by the CDC director that there's still grave concern that limiting or lifting these restrictions too soon can put us back, can set us backwards. If we move too quickly, we certainly will see a fourth surge. And I think that's what we're all trying to prevent. And again, education is key, right? Educating yourself, reaching out to your community members that are well educated about COVID and the COVID vaccine, your medical professionals, your nursing professionals is really important. Hand washing is still, it seems so simple, just like mom's chicken soup for a cold, but it is the #1 way to prevent the spread of disease and illnesses. Making sure those hands are sudsy, that water is warm, and we're scrubbing, for at least saying the alphabet twice through. That's an appropriate amount of time. Again, wearing masks and social distancing. Certainly, we talked about natural immunity, and the vaccinations will help control that fourth surge. And we're reaching 3 million people a day with these vaccines, but people are still vulnerable. There are people that, for some reason or another cannot get the vaccine, whether it's because of the unavailability in their community, whether it's because of a comorbid condition or another medical condition that's preventing them. So we need to do our part to protect those people that are still vulnerable. We still are working and fighting against these new variants. We do know that these vaccines some of them are effective against some of these variants, but we don't know much about the others. And so we still have to be very vigilant and not let our guard down. Our timing and our patience is essential. There is a lot of our healthcare workers are working extra shifts to put on these vaccine clinics for people. It is more widespread into pharmacies now, which is wonderful. And like we said before in this lecture, any vaccine you can get is good, whether it's the Pfizer, Moderna, J&J. Getting something is better than getting nothing if you're able to do it. And so we're part of the solution. We have to be conscious about this. And the next 3 months and potentially even 6 months is absolutely critical, especially going into the summer months. People get really excited. They let their guard down. It's beautiful weather. Gatherings are really important, barbecues, graduations, etc. But we must remain vigilant or we are going to be right back in the same place we were a year ago. And it's going to be even harder the second time around.
So good, so good. Thank you, Michelle, for giving us the current face of what the pandemic looks like and how we still have to be mindful that, yes, it seems so close and so enticing and just on the edge. We have a vaccination. Yay, we can break free, but we still have a ways to go. And so your patience and your diligence and your commitment to not only your health, but those around you. It's fine what decisions you make for yourself, but please be mindful that that's not everybody's position. Some people are truly still very afraid. Some people are compromised and you may not even know their story. So we have a responsibility, if nothing else, to be respectful and mindful of one another's humanity, our existence in this world together. And we want to get back to being able to hug and kiss and barbecue and all those things that make us who we are and those things that appeal to our humanity as well as our psyche. Everybody is not okay. We did a panel, a COVID discussion, probably about middle of the pandemic, talking about the fact that everybody's not okay. So to help bring some ease and some comfort with that, we must take responsibility for our actions. We all have a part to play. Whatever that part may be for you or how you define it or show up with it, you have a part to play. And so we're just asking tonight that you take this information and you process it, you pray over it, and you make a wise decision. But please know that you have a responsibility, that we all have an expectation that you would be responsible to uphold that. And so we have some questions for the panel that we want to address tonight. And so we're going to go through that and give you the most sound information that we can as it makes sense. But please know that some of these decisions and some of these questions, the bottom line and the foundation of this is that you must check with your primary care provider. We are not giving medical advice as to what you should do if you have existing comorbidities, you're currently on treatment, you're currently under the care or guidance of a provider. Your absolute final decision must rest with the information that your provider is giving you, because they know you. I can tell you all day long that I treat my immunosuppressive patients, but I know them. So that may not be your story. That may not be what Michelle tells her patients or what your physician or clinician has told you. So please, 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 please do not neglect having this conversation with your providers. Please don't do that, especially if you are battling multiple comorbidities and have a risk factor that may make you more predisposed to having a higher incidence of a reaction to the COVID vaccination. And there may be special precautions that they would advise you on. One of the things that I've been advising my patients, that if you're on steroids, I need you to stop those before you get the vaccination. So that is information that requires a one-on-one discussion with your clinician. Okay, so I'm going to start with Marsha. Can you please address the question about should I get COVID tested prior to getting the vaccination?
No, there would be no reason why you would need to be COVID tested prior to the vaccination unless you have been exposed to COVID or you have signs and symptoms of COVID. Then I would say you would need to be tested. But just to be tested just because there's no clinical reason for that.
Thank you. I would absolutely agree. It does not change what the recommendation would be. It only would change, as Marsha said, if you are positive. Obviously, there is a window of time that you have to wait to be vaccinated, but really getting tested prior to, what is the weight of that? Are you doing that to decide if I'm going to get it because I'm negative, or you're going to wait till you're positive to get it? I don't know the utility of that information. So it would be in your best interest to decide if you're going to get it, and get yourself scheduled as soon as possible. Mr. Noah, can you take this question for me, please? How effective are immunity substances such as vitamin D3, zinc, sea moss, vitamin C, and elderberry for COVID protection?
Thank you. I think that you all have said it very clearly when it comes to the additional recommendations related to supplements. It would be very important for you to talk to your healthcare provider. Again, it does not negate the need to have the vaccination and the importance of the vaccination. If those things are already within your regimen, I would say, based on your physician or your provider's recommendation, to continue with those things. However, those are not substitutions for the vaccination. And we cannot, again, I guess, Dr. Marsha mentioned, the myths of people in the community recommending that those be the things that we take in, as opposed to doing the vaccination. But again, we want to stress the importance, one, of the vaccination, and two, consulting with your healthcare provider for the most appropriate treatment for you, given your health history and potential risk for developing COVID-19 secondary to exposure.
Absolutely. Thank you so much, Shanoa. Michelle, please answer this question. Is there any harmful ramifications for getting the vaccination before the 90-day period after testing positive for COVID?
Yeah, thank you. So, you have a natural immunity after within that 90-day period. And so your body may not respond appropriately because it's still kind of active against the infection that you had. And so there is a reason for that 90-day window, because that seems to be when the immunity drops off. So it just may be that the vaccine isn't as effective if you get it before that 90-day window.
Absolutely. Thank you so much. And some of the literature has also spoke to if you were treated for COVID. So there are also specific guidelines that if you were treated, because some of the medications may be counterintuitive to the productivity and response of the vaccination. So waiting that 90 days is absolutely really, really important to the behavior of the vaccination at large. Thank you so much, Michelle, for that. Some other questions. I'm going to address a couple of these questions. Someone has asked, what's the fatality rate of those vaccinated? And do you foresee vaccines being mandated for us getting back to work because we won't know who is vaccinated? First, the numbers of fatality are very small and are still yet to be fully released, because the fatality associated with those that have received the vaccination are related to other complex processes. And so we don't have data to say that the vaccination is killing people. It is the vaccination or the immune response. Again, that's why we said talk to your physician or your clinician about your health status, because we know that the behavior of any immune response will trigger every cell in your body, from the hair on the top of your head to the toe on your pinky, the nail on your pinky toe. So it is so important for you to have those discussions if there are risk factors. So yes, I know we've heard some cases where individuals passed away after they got the vaccination, but I caution you to read and fully understand what was happening with those individuals and what it triggered in their body. And that incidence has been very small. It has been very small, and not enough to say, be fearful that this is going to cause you to become sick and die from it. So please be mindful of that. As opposed to workplace mandates, right now, no workplace can mandate you to get it. We don't know what that's going to look like in a year, especially as vaccination, as more of the population is going to be vaccinated. But what that may look like a year from now, we don't know. Places may be able to say you can't come back to work unless you get A, B, and C, especially if 90% of their workforce has been vaccinated. But right now, no place can mandate it. They cannot mandate for you. They can strongly suggest it and heavily recommend it, but no place can force you. And you have to evaluate your work situation. You know, how exposed are you to the population? Are you someone that's sitting in a cubicle and don't deal with many? Maybe you may think it's not for you, but when you have to leave outside of that, you still have an exposure risk. So again, it ultimately will boil down to what you think is the personal best decision for you as it relates to becoming vaccinated. I'm going to ask one of the panelists to speak to your views on safe travel and when will this be able to happen? Any one of the panelists can take that. We don't know. We don't know. That is absolutely a state by state decision as states are opening up, right? And allowing people in and allowing individuals out. We know that international travel is probably a lot harder and a lot more strict than local travel. So it really is at the jurisdiction and at the sanction of these states and these countries to say who they will let in. Trust me and believe, if you have a country that has the incidence of 2 to 3%, you're not going there right now. If you're coming from the United States, you're not going there right now.
And Gia, I think you make an important, an important point, and again, it kind of circles back to the travel, even from state to state, is that there are states that are seeing surges with these new variants, right? And so it's not even looking at what the state guidelines show. It's what I think we are informed as, individuals, what's safe for us and for our families and for the community around us to look at and say, okay, should I go to this state when I know that, there's an 8%, infection risk with a different variant. So that's going to, again, those changes are going to start to affect these kind of travel restrictions. And I know even for us at work, although international travel is still off limits, but domestic travel, although it has been slightly lifted, it's strongly strongly recommended that we really think before we kind of book it, right? To cause pause. Because again, what we're seeing is, the past weekend or the past several days, I was looking at some data, 1 million people a day are traveling on airplanes. And that's a big incubator. So we have to be cognizant of that.
With one-way airflow. One-way airflow. So again, it's being mindful of where you're traveling, how often you're doing it, and pretty much, oftentimes outpatients are we advise them to self-quarantine for 10 to 14 days if they have been to high-risk states. So it's just getting that information, and the biggest thing with that right now is about the variants that are now showing up in these other states, such as California and Florida, and internationally, these and globally, these other variants are showing up at a higher rate and a higher pace. So we just encourage you, make informed decisions, research what's happening in these places that you're entertaining going. I get people want to travel. They want some mental reprieve, some physical reprieve. And I encourage you, do what you must to stay healthy, but make sure that you are researching where you're going and what the virus is doing in those states.
And also, Gia, just making sure that people research at kind of legitimate sites, right? The CDC is a great site to get information from, because you know that it's going to be constantly updated with information.
The CDC website and the WHO organization are your most reliable sites to get these statistics, because literally they are either updated every 24 hours or they are updated within a 7-day range. So that's going to be, and Tanoa said it best, or someone said it, Dr. Google cannot be your Bible as it relates to what's valid information. CDC and the WHO organization, those are our go-tos for that information. And obviously that information comes through the news as well, CNN, the doctors there. So some other questions more local to Maryland. Someone's asking, in the near future, Maryland and surrounding states implementing a COVID passport system. So I'm assuming they're asking, are they going to be implementing a COVID passport system? That's going to be sanctioned state by state, and that information as to what states are going to be doing that, if they're going to be doing that, I would encourage you to, one, check your local health department. Listen to what your governor is saying, and the mayors of those select states and surrounding counties. I don't have that answer to, I don't know if those of you that are in Maryland can speak to that, but I have not seen anything about a passport for coming in and out of Maryland.
So not for Maryland yet, but it is a lot of conversation, and also looking at an electronic tracking mechanism. They do have the ImmuneNet site for registering and seeing, but nothing has come out yet, at least between the District of Columbia and Maryland, but we have been talking just to see what that looks like and will require.
Okay, thank you for that information. The CDC is stating that 3 feet distance is safe in schools. How true is that? Want to speak to that, Marsha?
Well, I would have to say that the information that they're putting out for you are the recommendations that are proven right now. So if they're saying that that's adequate for space for the children, and I mean, that's just what we have to go with. I will say, if you don't feel comfortable, virtual school, homeschool is still an option for you to keep your child in that setting, if your jurisdiction still allows that. If you do not feel personally comfortable with the 3 seats apart, then you can absolutely keep them home the way that they've been doing.
Can we just be real? Can we just talk real for a minute?
Yeah.
It's happening at 6 feet. So we all know that a sneeze travels 20 feet or more. So 3 feet, 6 feet, the precautions are
The same.
the same. The
Mhm.
precautions are the same. The mindset behind children is that there are low documented cases of children being affected by COVID. That research is still being out and is still ongoing as to our children, especially when you start looking at children 3 years and 3 years and younger, how they are impacted by COVID. My grandson is in preschool. I promise you, those children don't sit no 3 feet apart. When I drop him off for school, the little girl waiting in his cubby like, "Hi, Caden." It's not happening with the little children. So we still have to be protective and make sure we're sanitizing, we're washing, we're doing those things to help protect them. But there has not been any data to support that children are being affected by COVID. But again, we're still learning so much about the behavior of the virus, right? So the safety precautions have to be the same, and the decisions you make for your children. The vaccination, and someone asked this question about this, Wacomico County Health Department is beginning to roll out Pfizer for ages 12 through 16. Is that going to be the case for Baltimore City? Check your local health department and stay in tune for what they are rolling out, again, for the respected counties and cities of your local community, because they will be different. And that rollout, more likely than not, is going to happen across the board, but it's going to be a rollout phase, just like it was for healthcare workers, clergy, those on the front line, et cetera. It's still going to be rolled out in phases because, again, those populations will be monitored, especially high-risk populations and high-risk areas will be definitely assessed. Someone asked the question, does the vaccination impact fertility? We have no way of knowing that. We have no way of knowing that. As best we can answer that question to the person that asked that is that this vaccination is not designed to destroy our body's natural functions and protection. It is designed to trigger what the body is designed to do, and that is protect itself. Our body, God made a wonderful, wonderful machine when he made the human body. And we are naturally designed that when disease and infection show up, we are designed to protect ourselves. Illnesses prevail when our immune system is weak and when there is a point of entry that is unfamiliar. And as Marsha discussed, how the vaccination works is it tells your system, hi, hello, here I am. I'm familiar with you now, so you can mount the proper response. It is not designed to destroy what your body is naturally capable of doing. Can you contract COVID between receiving the first and second shot? Michelle, you want to talk to that?
Yes, you can, because you're not fully vaccinated. And there's a reason, again, like you said, and as Marsha had described, it's like that first initial hello, how are you? But then it's your body's second, the time that it sees it that really starts to kind of compute how it's going to take care of this kind of enemy. And so then after that, it's another 2 weeks for it to build memory. So yes, you can contract it in between doses.
So really important. Again, that's why masking is still so important because again, in between, as best we know, one vaccination provides about 60 to 65% protection. Full dosing, you're about 85 to 95% fully protected, or what we would call engraftment of your immune system. So thank you so much. I want to thank my amazing panelists. Certainly thank you for your knowledge, your experience that you have shared tonight. Just at a broad statement, again, I have questions about immunosuppression, medications. The statement that I will speak to that is, please talk to your clinician or your physician that is managing your health. We don't want to tell you anything that may speak against those that are over your care or speak against anything that may be detrimental to you, despite what we know the vaccination is designed to do. We all still are dealing with some different things. And so please have those conversations with your physicians. Don't be afraid to ask those questions. That is what we're here for you to have those questions and for you to ask about your health and what's in the best interest of your being. So please have those conversations. If you've gotten the vaccination, someone asked me, can you take Tylenol? Yes, you can take Tylenol if you have symptoms. I don't necessarily know the benefit of it empirically, especially if you don't necessarily get the symptom, but certainly there is no harm to you taking a dose or two to help alleviate, again, the response, not a side effect, not an allergy, not I got COVID, but the response, okay? So again, thank you all so much for showing up for you tonight, showing up for your family, showing up for the community, and showing up because you care to know more. We are empowered when we know better because we are more amped to do better. I absolutely want to give honor to my pastors who are committed to educating the community and taking the responsibility that we have as leaders of faith, as leaders over a flock. I honor them for always empowering and educating us at large to do what's right and to make informed decisions. So pastors, if you guys have anything to say or ask, I'm going to turn the mic over to you.
Pastor Linwood? I just want to say thank you. You all did an outstanding job. You covered so much information in a small amount of time. And I really believe that what you shared tonight really helped people to not only be informed, but to feel more comfortable about their decisions going forward, because now they have solid information to use. Are you able to take the PowerPoint down, Minister Gia? So everyone can see your entire team, but we just really thank you tonight. What a blessing. Just sound information. So I want to say thank you to all of you. And I also would like to close out in prayer for all of you, because you're on the front line and you are our lifeline. So we want to, can I take a moment and do that? Elder D, did you have any final comments?
No, ma'am.
Okay. Well, Father, thank you for these amazing panelists. Thank you, Father, for what they did even before COVID began, but even more so what they're doing now. Thank you for their dedication tonight. They took of their free time to inform the public, and we so appreciate that. I pray that you would continue to bless them, cover them, and protect them. Protect their physical body, protect their minds when they feel weary, their bodies when they get tired. And God, when it becomes a bit overwhelming, lift and encourage and strengthen their spirits. And we thank you for all of them tonight. In Jesus' name we pray. Amen.
Amen.
And
Thank
Dr.
you
Tia,
again.
thank you for continuing consistently being such a blessing to the house.
Thank you. It's my privilege. Thank you so much. Hi, Pastor Linwood.
Hi, Dr. Gia.
Thank you again. Thank you, Michelle, Tanoa, Marsha. Thank you forever. Always when I ask, show up and serve and support. I thank you so much. I love you guys tremendously. And we thank you all. Thank you, Elder D. Have a wonderful and amazing night. Be safe. Take care of yourselves. And we hope to see you soon. God bless you all. Good night.
Thank
night.
Good night,
you.
everybody.
Good night.